We have to open up the scar again, do another open rhinoplasty. Also put a piece of cartilage called a spreader graft along the right side. Hopefully you have a good amount of cartilage in there.
My name is Megan, and I'm from Sarasota, Florida, and my nose is like a construction zone. I've got bumps in the bridge, it's long, it's crooked, I'm kind of over it.
For me personally, it's just really hard to see that you don't see what I see and everybody else sees, which is a beautiful woman.
I don't have any confidence.
We really have to make sure we find the right doctor, and I think we have. I'm gonna be looking forward to see what he has to say.
Yeah, me too. It's been 26 years since my first surgery, and the aging process has definitely taken a toll on my nose. The bumps of my tip keep getting bigger and bigger. I'm just afraid that the bumps are gonna push through my skin. I feel I really need it, not just cosmetically, but almost medically for, my nose and how it's changing and stuff.
So we're gonna feel a little bit here.
Boy, thin skin.
Yeah, your skin is extremely, it's like wafer thin. Your bones are asymmetric, your left bone is wider. Turn your head that way for me for a minute. Yeah, even here you can see the middle vault's completely gone.
Yeah.
The biggest issue with Megan's nose is that the doctor removed too much cartilage, so now her nose is falling apart. To make matters worse, Megan was born with extremely thin nasal skin. So that means you can see every sharp point and irregularity that the previous doctor created. It's a complete mess. All right, so let's talk about your nose. You're missing cartilage here, missing a little cartilage on the right, or it's pushed in. And around your tip, we need to camouflage everything. So do you know where I take cartilage from?
The rib.
The rib. On top of the rib, there's a little piece of covering called perichondrium. I'm gonna use that to help build up some thickness to your skin right around here. And when we lift up the skin that's stuck to your cartilage, there's a small risk of necrosis. You may even wake up and I might have a leech on your nose if I'm worried about your blood flow. We have to do leeches sometimes to help with the blood supply. What do you think? Do you want to do this? You want to take that chance?
It's scary to hear all those risks again, but I think I want to go for it. Before my surgery, my nose was like a construction zone. There were bumps on the bridge, it was crooked, and I had zero self-confidence because I felt like people were always focusing on my nose. But now, thanks to Dr. Nassif, that witchy nose is gone. The bumps have been removed, my nose is straight, and I feel like I'm in the spotlight instead of my nose.
Tell us a little bit about you, what happened, and what you're here for.
So, when I was 15, I hit puberty. The hump came in, just that traditional Middle Eastern hump. And my parents were like, look, if you want to do this, let's do it. I was so concerned over going into sophomore year and having everybody know that I had a nose job that I said, just get rid of the hump. And he did.
The problem with just removing part of his hump is that will in fact make her nose look longer. So although the surgeon wanted to please her, he actually traded one problem for another.
I was initially extremely happy with the results. And then I started realizing my nose is crooked.
Okay.
I can't breathe. I get really congested easily. Every time I get sick, automatic sinus infection. I think because it doesn't drain properly or something. I don't know.
Okay.
All that stuff I feel like progressed. I went back to him and he said, your nose is fine, you should get a chin implant. And I was like, no, thank you. So we left.
Well, that's gonna really help your breathing.
Yeah, exactly.
I don't know what that doctor was thinking. If a patient comes in and her nose is messed up, don't offer to do a chin implant. That's insulting to a patient.
I'm a light sleeper, so I can't go to sleep with her because I won't fall asleep. And when I mentioned it, she goes, I think maybe that has to do with my surgery.
Yeah.
And so when we thought more about it, she goes, when I pull back on this part of my face, actually, I'm able to breathe through this nostril.
I think it's time to examine you, so let's go in the room and we'll take a peek at your nose.
Thank you.
When Pardis tells me that she has to use her hand to open up her airway by pulling on her cheek, that's a classic sign that she has nasal obstruction. So what I need to do now is get her in the exam room and check to see where exactly is her problem. So, here's what we want to do.
Okay.
Feel your nose, touch it, look inside.
Wow, look.
Yeah, she's collapsed.
It's turning right.
I mean, the tip is just kind of floating, no support. Check back. Do we have a mirror right there?
Oh, you can see
There you go.
Let's have you take a peek. So here's your deviated septum.
Oh, wow. I'm really shocked seeing my deviated septum for the first time. I didn't think you could actually see it in a mirror.
The doctor took down the hump, but when you take too much bone down, you get down to cartilage. When you file down the nasal hump, you're left with a gap in the nasal bones. And to correct this, you have to fracture the bones. What Pardis' surgeon forgot to do is fracture the nasal bones. So now she's left with a gap, and that is called an open roof deformity. So you have to fracture those bones.
Okay.
We have to open up the scar again, do another open rhinoplasty. Also put a piece of cartilage called a spreader graft along the right side. Hopefully you have a good amount of cartilage in there.
Okay.
I'm definitely scared. It's a lot more extensive than I thought it was going to be, but I'm really, really looking forward to being able to breathe properly.
Now I can actually smell the champagne. It's crazy.
Oh, yeah.
It smells so good.
That's
Oh, that's nice.
And I can taste it a lot better too. Before my surgery, my nose was crooked, it was collapsed, I couldn't breathe, and it just made me feel self-conscious. But now the septum is the size it should be. It's no longer crooked at all, and I can breathe like I should. I'm not snoring anymore, which is really just a breath of fresh air.
So tell us what happened.
When I was 4 years old, I went to go pet my family dog, and I think it kind of got freaked out and it bit my nose. Next thing I remember, I'm just waking up and like, I'm in a hospital bed.
Right. How many days after the injury was the surgery done?
The same day.
Yeah, the
Same day.
Right.
Say that flapped in.
So what they had to do was actually grab a little bit of this part.
Extra
and,
skin there.
Yeah, they stick it there for like 3 weeks. And we had to, every week, go to the doctor's office to make sure that that didn't die.
The doctor did the best they could at your age, at the age of 4, but now we have some discrepancy of tissue. When you use a flap, you're moving one tissue on one part of the face to another part. In Marcelo's case, it was the cheek to the nose. The issue with Marcelo's nose is that the flap is a permanent fix. He kept growing, but the flap did not.
What was it like being in school as a kid with this?
So I lived in Ecuador until I was about 9 years old. And then we moved to Charlotte. A new country, new culture, a new student. And then I had like this obvious scar. Throughout puberty, my face was developing and all my features were growing, but my left nostril, it was the same nostril that I was built when I was 4 years old. And that's what I have now. So then definitely a lot of teasing and name calling, then like having confusions with my sexuality. That started playing to factors into like teasing as well. It was a lot of pressure, and I would like cry to myself a little bit and then just kind of recompose myself. So like, this is actually the first time my family hears about this.
Really?
Yeah, it makes me sad. Some of the stuff that he's saying today, I have never heard before. It makes me feel guilty because I feel that I could have been a lot more there for him. He has always been like so sweet and very like close to us.
He is the best son ever.
I think my nose makes me stand out, and that's the last thing I want to do. So I'm not dating anyone now. It's because I just get so insecure about it, so I just shut myself down. It sucks.
Let's first talk about your scar. Let me just feel. All right. So you want to cut that out and stitch the tissue together. It's called the scar evasion. Now your nose, let's talk about your nose. So right now, the actual flap is kind of fat. It's called the trapdoor deformity.
Right.
So I want to lift up a piece of that flap, make it a little bit flatter so the contour is a little bit better. Take a piece of skin and cartilage from your left ear, put it in your nostril to lower it, called the composite graft.
Dr. Nassif is really saying all these doctor terms, and clearly I'm not a surgeon.
This is going to give us a good result.
Oh my God.
No
I would
guarantee.
literally cry. The fact that it can be improved by the slightest bit, sign me in.
This whole area on the left is not going to look symmetric. You know, it could be a 50% improvement. What do you think of what I said?
I know like your skill level, and I know that like,
It might not have anything to do with my skill, because there's risk with nasal surgery.
right.
What if this, for some reason, all of a sudden doesn't do well?
No, yeah, and I'm very aware of that.
So you want to do this?
I want to do this. After 16 years, like, now is the time to do this, really.
There's no doubt that operating on Marcelo's nose is extremely risky, but this is a problem that's been haunting him for a long time.
Before the surgery, a dog bite had left me with scarring on my cheek and nose and a bulky asymmetrical nose. Dr. Nassif even said that there's not gonna be a huge improvement on my nose. But now, seeing the result, I'm just completely blown away by what he has done. The scars are gone, and my nose is smooth and proportional. Now I can worry about what real people worry about. Graduation, finding a job, finding a husband.